Hello, everyone, and thank you for joining us for COVID-19 and Seniors, Facts Not Fear. We're so excited to bring this live stream to your homes and hope you find this this presentation timely, informative, and valuable. Following the presentation today, we'll have a live Q&A session with our expert panel. We received a lot of great questions so far, but would love to keep them coming. We encourage you to ask questions throughout the presentation. Our team is monitoring our Facebook and our website, and we'll do our best to answer as many questions as time allows following the formal presentation. If you're watching from our website, there's a chat box just below the video screen where you can enter your name, and then you'll have access to a chat room where you can ask your questions. And if you're watching from Facebook, simply type in the comments from within the video, and we will make note of your questions and we'll get to them after the presentation. On the agenda for today, we're going to break down our presentation into two parts. Part one is where we'll talk about COVID-19 and the hospital system. In part two, we'll talk about COVID-19 and the impacts that the pandemic has had on the senior population. And in part three, we'll talk about COVID-19 and senior living, the impacts that it's had on the industry as a whole and the residents and staff who work in the communities. So with that being said, I'd like to introduce you to today's panelists. Joining me are 5 experts in the industry. Covering the first portion, the healthcare system for a panel presentation today, we have Dr. Tobias and Dr. Ceda Lopez, both of Tower Health. Covering part 2, COVID and seniors, we have Izzy Porter from BAYADA Home Healthcare. And covering COVID-19 and the senior living industry, we have Dr. Hopkins and Garland. So I'd like to formally introduce you to our first presenter today. She is Dr. Tobias. And Dr. Tobias is a graduate of the Philadelphia College of Osteopathic Medicine. She received her training in emergency medicine at Einstein Medical Center and is board certified by the American Board of Emergency Medicine. She's been practicing emergency medicine at Pottstown Hospital Health since 2006. Dr. Tobias currently serves as Emergency Department Director and has been Chairman of the Department of Emergency Medicine since 2015 and was recently promoted to the position of Integrative Medical Director. This new position provides quality alignment and oversight to all of the community-based emergency departments in the Tower Health Network. Dr. Tobias is going to discuss with you today the impacts that COVID-19 has had on emergency care, namely people not seeking care when they should, and the impacts this has on patient health. So Dr. Tobias, I'll let you kind of take it away.
Good afternoon, and thank you for having me. So I wanted to start with this slide because I'm sure a lot of people have seen all the articles in the news. We know that emergency department volumes during the first COVID surge were at least down 42% across the country. And we know that certain medical conditions such as heart attack, stroke, and diabetes and uncontrolled blood sugar were really affected. If you look at the numbers, we know that heart attack visits were down 23%, stroke around 20%, and then for diabetes with blood sugar around 10%. And at the time of the first COVID surge, 4 in 10 adults said that they would not seek emergency medical care because they were worried about getting exposed to COVID in the emergency department. So I just wanted to highlight sort of where we are for perspective for our emergency department visits. So we started out the year very strong here at Pottstown. We were seeing an increase in growth in our visits. And then you can see a sudden sharp decline in March and a further decline of over 50% of our visits in April. We are still, as you can see, as of September, still struggling to get back to normal volumes because most people are still afraid to come to the emergency department. So it has hit our volumes very hard here at Pottstown. So one of the things that we noticed was a huge decline in our stroke patients. So in order to be a stroke alert in the emergency department, you have to be a candidate for the clot busting medication called TPA. So you need to be in the emergency department for the onset of symptoms at least under 4.5 hours. So we track this in the emergency department by how many patients are coming in within, we call the window to get TPA. So you can see averages in the beginning of the year sort of around, 50, almost 60%, and a very, very sharp decline in April when we were in the middle of our first pandemic surge. So we know that patients who were having stroke symptoms were not coming in time. And we saw this time and time again in the emergency department. Once the numbers started to go down for COVID, we saw an increase in patients coming back in the window for being, a candidate for therapeutic treatment. So this is something that we watch closely, and you can see it's affected stroke here at Pottstown too. I was asked to partake in an article by the Philadelphia Inquirer as to what's the big deal if people aren't coming. So for instance, with stroke, if you have a TIA and you don't come to the emergency department because you think, oh, this dizziness, this weakness, this will get better, you're more likely to have a stroke within the next 90 days. So all of the literature shows that if you have a TIA, which is a mini stroke, you're more likely, anywhere from 2 to 17% likely to have a stroke within the first 90 days after the TIA or the mini stroke. The other thing is, we know long-term patients that have a TIA mini stroke are 1 in 3 of those patients will go on to have a stroke at some point during their lifetime. So it's very important that people seek the care they need when they're having symptoms and not be afraid of COVID. Because this was such a huge issue, not only across, Pottstown and Montgomery County, but nationwide, we partner with someone called the Tri-County Health Council. And what that is that's a community collaboration that is the hospital. It is the Tri-County Health Network. It is Community Health and Dental, which is our federally funded healthcare system here in Pottstown, and also Creative Health Services, which is the main provider for mental health and behavioral health in Montgomery County. So we partner with them to create a marketing campaign to let people know it's safe to come back to the ER. It's safe to come here to get your care. And 2 of the things that we signaled out were stroke and heart attack, because we want people to know that it's okay to come back to the emergency department. So if I can leave you with anything in terms of the emergency department, I want people to know that it's safe to come here. We have extensive cleaning measures between patients. We are all masked. We are wearing all appropriate protective equipment, and we provide masks to patients. So we do not want any patient to delay emergency care for fear of contracting COVID. So please, if you have any symptoms, anything you feel is emergent, we want you to come to the emergency department and be checked out. So thank you for your time.
Thank you, Dr. Tobias. I'm sorry, I forgot to unmute myself. That's really valuable information. I hope people walk away kind of feeling a little bit more comfortable and confident in going to the emergency room. And the risk of not going is far greater than actually going to get the care that you need when you need it. So I appreciate you taking the time to do that. Thank you.
Thank you.
Next up, we have Dr. Ceda Lopez, who graduated with clinical distinction from Ponce School of Medicine in Ponce, Puerto Rico in 2013. Dr. Ceda Lopez completed his internal medicine residency at St. Luke's Hospital in 2016, serving as chief resident and receiving the Senior Resident of the Year award. Dr. Ceda Lopez began practicing as a hospitalist at Reading Hospital in 2016, where he developed experience with unit-based clinical leadership. He also helped develop and maintain the intermediate unit and the second observation unit, working with residents and advanced practitioners. Dr. Ceda Lopez currently serves as the medical director of hospitalist services at Pottstown Hospital Tower Health, where he focuses on providing patient-centered care. Dr. Ceda Lopez, I know you have a lot of boots on the ground experience working with the general population of the hospital during COVID. Let's talk about what the hospital experience looks like for someone when they're admitted to Pottstown Hospital Tower Health.
Right, certainly, and thank you for having me as well. Basically, what I wanted to talk to you guys is what does it look like when you come to the hospital? But before we go there, I want to focus on what is the same. Obviously, with COVID, we have had a lot of changes that have been happening, and everyone focused on what is different. But I think it is important to notice that the people that is caring for you, the nurses, the physical therapists, the physicians, the PCA, the janitors, we are all the same people that has been always there. In medicine, we like to practice with evidence-based medicine, and that's what we still doing during COVID. We find the articles, we find the studies, and based on that, we guide the therapies that we're gonna provide to the patient. Obviously, every patient is different, so we have to individualize that care and provide what is necessary. And we try to do this keeping a closed loop communication. What I mean with that is providers talking to the patients, to the families, to the consultants. So we are all in the same page and we are all aware of what is going on and can help on driving this care of the patient. So all those things remain the same. We can move, yeah. So during COVID, obviously, we have had a lot of changes. And I will say we have learned immensely from past February, March until now. Now we have treatment options that we have learned and we will discuss on upcoming slides. But basically, we do have multiple treatment options. We can use steroids. We have the medication called remdesivir, which help us out, as well as there are new medications in development, as is the antibodies that probably you have heard from the president's treatment. Also, we have learned a lot about the transmission. That was one of the things that was not clear initially. But now we know how to protect ourselves and protect the patients and protect the public in matters of the transmission. And as you guys are probably aware as well, we are in the process of developing a vaccine. This seems that it will be in the upcoming weeks that it will become available. And it has a pretty good success rate. The vaccine that is being developed is using the DNA or RNA or genetic material of the virus. So it's not like the virus is being injected into the patient. It's just some genetic material for our body to recognize and know what is going to attack if we get to be infected. Next slide. In matters of what it has changed, as we talk, everyone is going to be wearing face masks and personal protective equipment when you go to the hospital. And this is to keep you safe, keep the other patients safe, and keep ourselves safe as well. Restriction and visitations back in March, this was a big topic because all hospitals basically close all kind of visitations. As we have learned how to avoid the transmission of the virus, we have loosened up on those visitations, and we are able to provide those visitors with information and protective equipment in order to make those visits safe. So rest assured that if you come to the hospital, you're not going to be left alone and your family is not going to know what is going on. Also, when we are gonna discharge a patient, when we are in the process of discharging, we screen the patients that are gonna be going to skilled nursing facility or rehab. So every single patient is gonna be screened and we're gonna know their status in matters of COVID infection or not. To assure further when you move to that next step in care, that there's no risk of transmission, or we minimize as possible the risk of transmission.
Thank you, Dr. Ceda Lopez. That was really informative. I think as we move towards COVID-19 and seniors at home, I'd like to introduce you to Izzy Porter. Izzy Porter is a therapist with BAYADA Home Healthcare. She received her therapy degree from Arcadia University, where she's also a part-time faculty member. Izzy has a strong background in working with aging individuals and is passionate about falls prevention and fitness. Izzy's role is to make sure that BAYADA is doing its best to help seniors remain safe as they age. She makes sure that communication between a community's healthcare team and a resident's doctor is timely, accurate, and in their best interest. She also schedules wellness programming and health clinics to promote good health. So when talking about seniors and COVID and the impacts it's had on their daily lives throughout this pandemic, it's great to have you here with us, Izzy. She's a liaison of sorts between the communities and the healthcare system. So I'm sure you've seen a lot over the months. We spent a good deal of time discussing COVID and the healthcare system. So let's talk now about COVID and seniors in general. What are some of the impacts COVID has had on seniors in general, Izzy?
Thank you so much for having me. When I was asked to be part of this panel, I was really excited because I think it is really important to focus on how things are changing and also what we need to be focused on as opposed to all the background noise that we're hearing. So I wanted to focus first on what do we know, right? So the graph here shows from the CDC that back in June, we saw that you are at a higher likelihood of being hospitalized with COVID as you age. So unfortunately, over the age of 65, another wonderful thing is that we are at a higher risk of being hospitalized from COVID-19. Now, the ones who don't contract COVID, we're kind of facing some of these other secondary effects from quarantine and from being a little bit less involved in our communities than we used to be. So there's definitely some decreased movement, social and physical isolation that causes fear and anxiety. I know that there's people who also have increased fatigue and decreased motivation just to do things. One of the things that we really see a lot is the quarantine 15, right? Putting on that weight because we're not really doing as much as we want to do. So I know that for me, I started off feeling a lot like this gentleman over here on the left, right? Active, feeling good. And as the months have gone on, right, we're starting to feel and maybe even look a little bit more like our person on the right here. That's not abnormal, but there are things that we can do to combat it. So movement. I think everyone here, and I hope everyone here knows how important movement is and why it's important to stay active and exercise, but I want to break it down a little bit more on a level that hopefully should make it even more important for you. So exercise is going to help to increase our muscle strength and quality, leading to a more efficient movement. That way we're walking around a bit better. We have a lower risk of falling because still the CDC reports that about $50 billion a year is spent on the medical costs associated with a fall. So anything that we can do to keep that from happening, we want to make sure we are doing. Exercise and movement are also going to help with your cardiovascular and respiratory health, which means that we're breathing better, we have better blood flow to our brain, which is going to help us think a little bit more clearly, which is hard for some of us all the time, but especially now. And it's also going to help to increase endorphin levels, which are those natural opiates that help to increase our mood and reduce our pain. Exercise is going to help to improve our immune system response, and it's also going to help to improve our sleep quality and sleep cycles. Now, if we look at this list, these are all things that we know that people who do contract COVID have issues with. So the more that we can do to help to stave off some of those effects that we might be putting us at a higher risk of contracting the illness, the better. So talked about what is happening and what we should be doing, but how can we do it? So I want to look at this from two angles. First, physically, and second, we'll be talking about what we can do just for our emotional and mental health. So the American Heart Association recommends that adults should aim for about 2.5 hours a week of moderate intensity physical activity. Or if you're a go-getter, you can do 75 minutes of vigorous intensity activity. So that could be walking inside, which a lot of us are nowadays. If you can still walk outside, by all means do it. It really doesn't matter where you're doing it. You could be walking in a circle, but stay active. You can also take part in virtual programming and exercise classes. If you live in a senior living community, a lot of places now are doing much more of this. BAYADA also has a fitness and wellness arm that is doing a lot more of this with our senior living community partners. You can also challenge yourself and your friends and your family to stay active, send each other text messages, call, and just say, hey, what are you doing? Or, are you doing enough to keep yourself active? And then also you can think about your chores as daily activity boosters. Those of us who are a little bit younger, making the bed, doing the dishes, it may not feel like a big thing, but as we get older, some of these things can be a bit more of a obstacle. If we can tackle them and think about them from an aspect of improving our health, those dishes will probably get done a little bit more quickly.
Thank you,
And-
Izzy.
Oh, I'm sorry, I just had one more slide to cover if that's okay.
Yeah, please do.
So I just want to make sure too that we're thinking about our emotional and mental health, right? So if someone asks you to do something, let's get up and do it, right? Let's give it a shot. And I think it's really important, especially for our elderly individuals, to stay in contact with their family even more than we used to. And doing that with video is even that much more important, that much more special. Okay, it's really important to talk to other people so that we can help navigate the stresses and cope a little bit easier. But I think it's really important to think that it's okay if you're not feeling okay, right? I don't think anyone feels like this time is normal. And being okay with those feelings, or at least understanding those feelings, is going to help you to better navigate it. Okay, we want to all look at ourselves from our physical, mental, and emotional health, and improve those things as this continues to go on. So thank you for the time.
Thank you, Izzy. I think that point that you made, that it's okay to not feel okay, is really valid and really well said. I think we spend so much time focusing on, especially for seniors, I imagine, I can't personally relate, but I imagine that they spend a lot of time avoiding the potential of contracting COVID, and not experiencing or not being diagnosed with COVID is great, but it's also the secondary impacts that you experience when you're isolating and you're quarantining and you're not seeing your family and you're thinking about not being able to see them this holiday season. It all comes with a lot of secondary impacts that aren't so great. So I appreciate you taking the time to kind of shed light on them. That's great. Next, as we move on to the last portion of our presentation before we get to our panel discussion, I'd like to introduce you to Dr. Hopkins. Dr. Hopkins is the founder and president of CCS Healthcare, a healthcare organization that brings physician services into senior living communities throughout the region. Throughout this pandemic, Dr. Hopkins has served as a medical director at multiple communities, developed infection control strategies on the front lines, and served as an advisor to the Pennsylvania Department of Health. He's also consulted with more than 100 senior living communities in the region throughout the pandemic. Dr. Hopkins, after going through this list of everything that you've done over the last few months, I don't think there's anyone more qualified to talk about this topic. So I'm just going to kind of kick it to you right away. I'm excited to hear you share some of your insights and to learn more about your experience.
Thanks, Kate. Thanks for having me. I appreciate it. So COVID has been, experience for everybody. And I think uniquely in the senior living space, in both skilled and non-skilled communities have struggled in the beginning, but there's a positive message and there is positive activity surrounding what's happening. And I'm happy to say we have made progress, and it's been fairly significant. First of all, testing now is in the beginning was not widely available. It was very difficult to segregate and cohort and keep infected and non-infected individuals away from one another. And now I'm happy to say that the testing that we have available to us is very widespread and very accessible. Additionally, over the past 6 to 8 months, our infection control and understanding of infection control has become much greater than it was in the beginning. I mean, keep in mind, this was a new novel disease to everyone, the medical community and the senior living community. And it took time to better understand how to control an infection such as COVID-19 or the SARS-CoV-2 virus. And we have made significant progress in controlling the infection and keeping it out of the communities as a whole. And then when it comes into the communities, decreasing its level of spread. And I think this has a lot to do with staff education. Staff that wasn't familiar with infections control strategies or viral infections and how they spread has learned over this time, along with all of us, about best practices and how do we reduce the spread of disease. And that has really just been a tremendous benefit to the communities themselves. We now know, as Izzy pointed out, that very well, that social isolation was very negatively impacting our seniors that were quarantined, and have since put systems in place, programs in place, folks that are available at the communities to try and decrease the negative effects of social isolation, and use testing strategies to decrease the need to isolate and or quarantine. With that being said, part of the early on negative effects of the isolation was that folks in senior living couldn't have visitation with their families. Since then, through the work of the Department of Health in the state of Pennsylvania, visitation strategies are in place. There are different phases for communities and allowable activities at those communities based on their level of infection. And that was all released in June, July of this year, and have been working very well to allow families to stay in contact and even visit their loved ones in the communities in which they reside. And last but certainly not least, the vaccine. I'm sure we've all been very glued to the news about this. It's on its way, and that is about the best news we could have heard throughout this pandemic. Good news about the vaccine in senior living is the senior living space is going to be one of the first to get the vaccine. It's going to be delivered and distributed to our at-risk seniors in congregate care settings. And we're looking at, some distribution at the end of December and then into the early first quarter of next year. And all of these factors have resulted in my next slide, which is the following. So this slide is, it's a little small on my screen, but this is the number of cases in the state of Pennsylvania of COVID-19 in all of long-term care. That would be the Department of Health, licensed facilities, and DHS. What does that mean to our audience? It means both skilled, traditional skilled nursing facilities and non-skilled, which is what we consider personal care, independent living, and memory care communities. And as you'll see, early on in the pandemic, our spikes were very high, despite a subsequent elevation or quantity of overall cases in the population. And you'll see as time moved on, those levels began to decrease and even decrease substantially in the second and the beginning of the third wave. Now we are seeing an increase in those numbers, but what you'll see on my next slide is that the rate of death in the long-term care communities, the licensed skilled nursing and non-skilled nursing, has not subsequently risen by the same number. And that's a phenomenon that is not well understood, but we're very happy that it's happening, right? This has been studied both in Europe, the United States, and Asia. And you see on the left of this graph, the rate of death in long-term care was very, very high in the beginning. The severity of illness was much, much higher, and that has leveled off. And it's leveled off in such a sense that we're personally seeing it on the front lines as not as lethal of a disease as we saw in the beginning. My personal experience in working in North Jersey during the initial outbreaks out of New York City, to tracking outbreaks throughout South Jersey and into Pennsylvania, is there's just an anecdotal, because we don't have hard data other than what we're seeing now, but we're just seeing a larger number of folks that have the disease are just not getting as sick as they were before. That doesn't mean that we don't have to protect everybody against it. It's what we have to do. But it's good news that as we're getting closer to a vaccine being available, hopefully this pattern continues and the level of risk lowers. So lastly, I just wanted to touch on, Kate, real fast, is that one of the reasons why, senior living has become safe again, has become good again, is a viable housing option for seniors, is that we've learned how to handle this disease exponentially as in the beginning of the spread. So rapid widespread testing is available and can be set up within 24 to 48 hours. We're doing it. It's effective. The infection control strategies that we recommend to well-run communities, when they're implemented, it reduces the spread. There's also partnerships between the senior living communities, and this has led to develop COVID units as alternatives to hospitalizations for those that don't need a hospital level of care. Next slide. Okay, so the take-home message is senior living communities that are engaged and prepared to address the COVID risk can. It is a very safe housing option during the pandemic and beyond. I think as a senior, it tremendously reduces your variables and risk of exposure as if you were living, as opposed to living in the community. You have access to resources such as rapid testing. There's skilled staff to assist with the deleterious effects of isolation and quarantine to keep you active, as Izzy referred to, therapy, home health. You have access to home medical services, and there's strategies in place to help combat that social isolation as we get in deeper into this pandemic. So in closing, I think that, if I had a loved one that was thinking about senior living back in March, I probably would have said, hit the pause button and let's see what happens. But I do strongly recommend and change that opinion now that we're in November and have all these tools available, that I would promote and actually encourage my patients to move into a very well-run senior living that has access to resources. I think it's a great option for them.
Thank you, Dr. Hopkins. I know that Arcadia at Limerick Pointe is, when we open, going to be partnering with CCS Healthcare. And I think that we all feel a lot of peace of mind knowing that we have someone with your experience kind of helping to lead the way throughout our implementation of policies and procedures. So I appreciate you taking the time kind of sharing that information.
Well, thanks, Kate.
Yeah, as we move to the final panelist that we have today is Karen Garland. Karen Garland is the Executive Director at Arcadia at Limerick Pointe. She has over 30 years experience in the senior living industry and as a registered nurse. She's been with the management company, Vantage Point Retirement Living. She's worked with us in several of our communities throughout the years and brings a wealth of knowledge and experience. So as we prepare for opening Arcadia, Karen is really rolling up her sleeves and implementing the policies and the procedures that will take effect to ensure resident and employee safety at the community. And she's had a lot of time spent with residents, family members, and staff kind of going through some concerns that people have about moving to the community, working in the community, and Karen will be sharing that experience with you in her portion of the presentation. Karen?
Thank you. Oh, got to get me centered. There. They're going to kill me. Thank you. Thanks, Kate, for that introduction. Why am I lost?
Karen, move to your right.
There. Sorry, everyone. Okay. That's about the best we're going to get right now. So I really wanted to thank Kate for that introduction, and I'm extremely happy to be part of this panel today And listening myself to everyone who's spoken before, I'm excited that this panel has come together and that we're really going to focus on breaking down that fear and focusing on the facts. And Arcadia at Limerick Point, we are challenged. We're opening during a time that most people think that maybe to stay in their home is the safest place to be. And we're trying to show why we believe being in a community is the safest place. And obviously, it's very important of how we're partnering with, Tower Health at Pottstown Hospital, BAYADA, and CCS and Dr. Hopkins. So I wanted to start out just by going over the fact that we have all faced in healthcare history of diseases and new viruses that have affected, the global impact in healthcare at different times and the well-being of people. And it goes way back and it will continue to go forward. For myself as a young nurse, I was in the forefront of dealing with patients and taking care of patients that had HIV. And often when I think about COVID, I think about that fear we had at that time. We got to the point where you were almost even afraid to touch someone with HIV. The information at first was very difficult. I keep losing myself. Sorry, gang. The information at first was very difficult to understand, and to try to learn about it was, you're taking care of people while you're trying to learn about the disease and the virus. And so it's a matter of implementing things in a very swift manner. And that happened during COVID. When COVID came, everybody was trying to gear up as quickly as possible, but without really understanding this genetic material, this virus that has now invaded healthy cells and is replicating itself. We needed the scientific world and the healthcare community needed to gather information in order to understand about it, how it transmitted, and then how to break that cycle and eventually create prevention, treatment, or vaccines. So that's kind of where we are at the moment. So why will seniors want to stay in a community? On my next slide, the current pandemic really halted our normal life and living experience, and interaction with others is now really kind of feared. Living in an environment that you don't have direct control over creates a fear of the possibility of exposure. And you wonder, why then consider living in that community versus staying in your current situation? So I kind of wanted to go over what the pros and cons of that would be. We already talked a lot about socialization, but the truth of it is we know that socialization is truly hitting all of us, just not seniors, but it definitely impacts seniors, because what you have at this time in your life is your family, and your family is everything to you. And not to be able to have that interaction or to fear your family, who is your support mechanism, really enhances that feeling of loneliness. As well as all of us who are taking care of people who are trying to live our normal lives feel that social isolation. And now in moving into these winter months again, we fear, will it stop the way it did back in March? In a community, we believe that we can manage that issue with socialization through being around other people that can provide you that comfort of knowing that you're not alone, knowing that in an emergency, someone is right there. The other thing is, I think Dr. Hopkins spoke a lot about infection control. It is truly amazing how much we have upped our ability to have better infection control. We always had infection control, but we learned through this so many of the other high touch areas that maybe weren't focused on before. I think about myself when I go out into town and I'm in a local store and I'm at the gas station and now I'm seeing hand sanitizers. I realized that we had the potential to be transmitting diseases all the time. This is just one we didn't know and don't know how to prevent it or to cure it. So infection control procedures really became about this and high touch areas and understanding transmission. So we're very lucky that we're able to have access to the CDC information, the Department of Health and Department of Human Services. At Arcadia, we'll be working with the Montgomery County Health Department. And all of this information is at our fingertips. They do focus on seniors when providing the most up-to-date information and knowledge. And we are kept up to date as operation managers of a community. We have to follow those strict guidelines. We are more so than the general public. We will be reporting every day if we have any cases, what phase or stage we're in, who's getting tested, who's not getting tested, is there active cases, are they being cohorted, how are we measuring them, how are we preventing cross-contamination. We have to have staffing patterns and supplies for the taking care of people as they get ill and having to maybe separate them from the general population until they're well. We're understanding the 14-day self-isolation protocol and the 48 hours before contact better. So our testing kind of links to timeframes now that is allowing us to manage cross-contamination potential of exposure and transmission. There are cons. Obviously, the biggest con that comes with possibly moving in is that the unknown loss, or basically, the unknown loss of not being able to control your environment. And that is something that a lot of people fear once they get out of their own home. They're thinking, well, in my home, I can control it, but will I be able to control it in the community? The best way to answer that is I ask people to talk to us, just to ask the questions. We need to communicate to you so that you can better understand how we're dealing with it. And so when you talk back and forth, and what we're doing today is really trying to educate people so that the fear is lessened because the facts are better known. We know that in socialization, the truth of it is you have exposure basically because other people around you may not share your same approach. We know that if we wear masks and we social distance and we have proper hygiene and we attend events and we limit the size and we follow all those guidelines, that we are minimizing any chance of exposure, transmission, or an active case. Out in the general public, that is still not, that's an individual decision to follow it. But in a community setting, those guidelines are set and management will be there making sure that the process is occurring. What if someone is positive with COVID-19? And the truth of it is the possibility exists anywhere you are. In a community setting, you will have immediate access to healthcare and professionals who are well-versed and well-trained and available to meet your immediate need. And receiving care is vital if you contract the disease. And so we're on the forefront of assisting you through your healthcare journey. When you're in your home, we'll have Dr. Hopkins and his team, and they're even able to do telehealth. We'll be able to have, working with BAYADA, to look at people who might be losing their strength. And we will be working with Tower Health and Pottstown Hospital. And if it's appropriate to go to the ER, you'll go to the ER, but those decisions are made with a clinical team around you versus just kind of having to figure it out on your own. People become afraid that maybe staff will give it to them. Well, our staff will wear the personal protective equipment, but we're also understanding that we have to have supplies for that. So now we're doing burn rate calculations and understanding how much we need of each thing and creating supply partnerships so that What happened back in March hopefully will not happen again. And they are paying attention to senior living as one of those places that need to have access to this most important equipment, and for the staff taking care of you. So overall, on my next slide, we have been talking, as everyone has been saying here today, that vaccines are coming. Here's the interesting thing about the vaccines right now. We are actually, the CDC is partnering with pharmacies to provide that on-site vaccinations, and they actually have already reached out to long-term care communities, and already Arcadia is on the list. And that really is something that's important to me, because I think the delay initially of senior and long-term care, because hospitals were overwhelmed, the ERs, it was really difficult to spread and to understand the impact in every area of society. But now it's known that seniors and long-term care communities have to get the same focus as the hospitals do. And I'm glad. We all need to take care of the most vulnerable persons. Yes, the vaccine's in development. Their interesting fact is there's 234 companies working on various types of vaccines, with Pfizer having a 90% effective rate, and Moderna just came out with a 94.5 effective rate against the coronavirus. That's a stunningly high successful rate. And so it is moving under warp speed, and we do have to look at making sure that a lot of people are asking, well, who will get the vaccine first? There is a program under the CDC to have the most vulnerable, and it will also be the healthcare providers, and it will work its way down. So being in a community potentially allows you to get it sooner than anyone else. So finally, our hope today was that we created, I want to define, let me start with defining that fear is truly an unpleasant emotion caused by a brief belief that someone or something is dangerous, likely to cause pain or a threat. Where fact is a piece of information presented as having objective reality. So today, our main goal here was to prevent facts so we can eliminate some of that fear. And finally, Arcadia, we have our commitment. Being alive today during this pandemic has really changed the way we live our lives. We knew the first phase created life to come to a halt. The second phase was learning, adapting, and advancing the knowledge we got. On the third phase, we're attempting to create some normalcy back in life, but to remain vigilant for hopefully the fourth phase to eradicate the disease. So I end by saying, you've done your part, and the healthcare providers that are with me today want us to do our part, and we hope that we have taken the fear out of your life and give you some positiveness and some hope as we go forward, all dealing with COVID-19.
Thank you, Karen. I think that was very well said. Being your teammate at Arcadia is something that I'm super proud of, and I just appreciate you taking the time to share your experience and your expertise. I know we have some future residents of Arcadia listening in, and I hope what you conveyed, as well as what Dr. Hopkins, Dr. Tobias, Dr. Ceda Lopez, and Izzy talked about through the presentation helped offer them some peace of mind. And to anybody who's watching, I think everybody's perspective throughout the presentation was unique and definitely valuable. So thank you all. Right now, we're going to go into our question and answers panel discussion. Prior to the event, we got a lot of really great questions, so we'll be running through those. We've received a couple on the website, and if you are watching us on Facebook, We've been seeing that there are some sound issues that you might be experiencing. In the comment section, I've linked a direct link to our website, so that connection will hopefully be better. So if you are on Facebook watching, please use that link. I do want to remind you that you can ask questions wherever you are on Facebook or our website. So with that being said, let's dive right into our panel discussion. Okay, so one of the first questions that I want to tackle is a big one. Given the surge that we're kind of experiencing, I think a lot of people are wondering, this question I'm going to pose to Dr. Tobias and Dr. Ceda Lopez is how Pottstown Hospital and the greater community at large is preparing for the surge. We hopefully have more PPE and more equipment than more than enough to handle any surge or any increase in hospitalization. So can we spend some time talking about what the safeguards Pottstown Hospital is putting into place and what that looks like?
Sure, I can go first just from an emergency department perspective. So the fortunate thing is that we had the initial surge in March, so it really forced us to prepare surge plans then. So we're going to utilize a lot of the plans that we already have. So low level, I think the biggest thing is from an emergency standpoint is we don't want to fill all of our beds and not have beds for the people that are sick. So we have a lot of surge plans to take the lower acuity patients and screen them via telemedicine on an iPad and move them to sections of the hospital that is not the emergency department so that we utilize the beds here as needed. We also have a lot of specialty support in the community with orthopedics, cardiology, and gastroenterology. So if patients show up and it's not really an emergency condition, we can send them to the offices for a follow-up. So that's a nice thing to be able to have. And we also have the ability to screen patients and triage and swab the patients outside. So if a patient is a potential COVID patient, we're not going to bring them into the emergency department if they are healthy and not in any distress. So that's a nice thing. So we have a lot of plans in place that we fortunately did not have to use in March, but now we can use them if we need them. I think the other part of that is we've learned a lot about COVID and COVID treatment. So one of the big things you see with COVID is low oxygen levels. And, you know, when we saw it in March, we reflexively put people on breathing machines and we kind of learned that's really not the way to treat COVID. So we've learned a lot with that, and I'll let Dr. Ceda Lopez can talk about that more. So I think our overall treatment and how we treat these patients has changed, and that's really going to help us save the ventilators, the breathing machines for the patients that really, really need it. The other thing is there's some good data with some monoclonal antibodies that's coming out, so we may be able to treat patients that way. The other thing that we are working very hard on is a process to be able to monitor patients at home. So we will be able to discharge patients from the emergency department and monitor their oxygen and their temperature at home and be able to check in those patients daily. So that's really going to keep a lot of patients out of the hospital who probably in March would have been admitted because we just didn't know, you know, the treatment plan and we didn't have the resources that we have now.
Just to add to that, basically from a hospital and system standpoint, one of the things that we saw back in March is normally every hospital had contracts with just one company to bring supplies. Something we learned with this pandemic is like, hey, we cannot put all our eggs in one basket. Let's get multiple companies to supply the same products. So that is something that we learned, and it has helped us out in matters of providing the PPE. And hopefully, if we do see this second surge, like we will be better prepared in that regard. Something else we're trying to do and doing to help the patients is we are cohorting the patients when they are in the hospital. If you come in with COVID or very likely to be COVID, you will go to certain areas. Versus if you come in with, let's say, a hip fracture, you may go to a different area. the staffing of the hospital in matters of the providers and main service. We have up staff to be able to provide that care if, when the patient comes in, and try, as Dr. Tobias talk and express, like working with the community, the hospitals, the community offices and providers in order to create those completely round plan of care to really keep out of the hospital who does not need to be in the hospital. Some benefit that we have now is, as we talked earlier, is the fact that now we know a little bit more about the treatment. Initially, we didn't know when to start steroids, when to start remdesivir, or if it was even helpful. Now we have a stepwise approach that we can use, and the same thing with the amount of oxygen that we can provide. At the very beginning of the pandemic, what we saw was like you will go from very little amount of oxygen, they will jump to the maximum amount of oxygen that we will could provide because of the fear of what if we miss it. Now we know a little bit more of the disease, so we can treat it over a more stepwise approach. So overall, the time that we have had to learn, I think it have helped us. I don't want to sound overconfident, but certainly we have learned a lot with this time that we have had.
Thank you. Let's keep on the track of the doctors, Dr. Ceda Lopez, Dr. Tobias, Dr. Hopkins. I know Karen touched on Arcadia being a place where vaccines would be offered and distributed, but are there any plans to distribute the COVID-19 vaccine in the immediate local area? What would that look like to the general population?
For me, and I think it's kind of early I think in conversations with the Department of Health that they're starting to put together those distribution plans. And my understanding is that they're contracting with the larger organizations such as Walgreens and CVS to become the point of distribution. And then much like Walgreens and CVS will come into a community and provide the flu vaccination on an annual basis, I would think that there's going to be a similar approach to coming in and providing the COVID vaccine. Now, I mean, the good news is that this is already in the planning stage, even though the vaccine hasn't been distributed, and you're going to see a multi-phase approach with the highest risk population as well as the frontline healthcare workers receiving the vaccine first. And as Karen had mentioned, she had already registered the community for vaccination through CVS, I believe. So that my guess is there's going to be several distribution channels. I would assume Tower is going to receive some of that distribution, and there'll be multiple pathways, but you'll be seeing a community-based vaccination type of program where they come out to the community and vaccinate the residents on site.
So it sounds like it would be something that's more readily available in like a pharmacy type of environment versus the hospital environment.
I would ask Dr. Tobias to speak to that, as I haven't
Yeah, I think like Dr. Hopkins said, it's so new that we're just trying to figure out, for healthcare workers, what's going to be the phases in which we are going to vaccinate the healthcare workers here. I know we're going to definitely defer a lot of the stuff that's coming from the PA Department of Health as to what phase everybody should be in, and we will definitely follow their recommendations. But I suspect if I had to guess, the hospitals will probably get the Pfizer vaccination because of the ability to freeze it. So I know that Tower Health has already invested and bought more freezers because it's just not really something that CVS and Walgreens and some of these smaller places, mom and pop pharmacies are going to be able to freeze them. So I would think that if I had to guess, Moderna would probably be the stuff in the doctor's office because it can remain in a refrigerator, and the Pfizer product will probably go to hospitals mainly because of the storing conditions. But it's so new. We just put our vaccination committees getting together to try to talk about how are we going to do it within the health system so that we get vaccinated, the healthcare workers, and then that way when the patients come, they're not at risk because we've all been vaccinated. So
Thank you.
And one last point, it's going to be dependent on the activity and the prevalence of disease in each geography, right? Because it's going to be a federal distribution. So your hot spots, priority is going to go to the areas of the country that have the highest infection rate, and that's all to be determined. But they are expediting it, very quickly, and there's an aggressive platform to get this done.
That's great. Another question that we have related to the hospital system is, if I have to go to the hospital, can a loved one stay with me?
In the emergency department right now, we allow one visitor per patient, but because of COVID, we do not allow swapping of visitors. So we ask that if you have a visitor, that visitor remains with you, just because we're trying to limit the amount of people that are coming through the emergency department. I can't promise that it will stay that way, if cases surge dramatically, and it's really for the safety and health of not only the patient's family, and the staff. But as of right now, you can have someone with you. The other thing that we did do in the beginning when we did not have visitors is we used cell phones and iPads to contact family so that they could see their loved one in the emergency department. So that's what we did. And then I'll let Dr. Ceda Lopez talk about inpatient.
Yeah, in the inpatient side overall, the main thing that is going to define the visitation is the reason you're in the hospital. If you're with COVID, obviously we will like to limit the visitation to try to limit the spread and isolate the patient if possible. But if you're not doing well, certainly there is exceptions that it can be made. Overall, the guidelines have been varying a lot, and I wouldn't be surprised if next week they will change again because we go as this progresses. But so far in the inpatient side, it is 1 or 2 visitors per patient. And as I mentioned, if it's COVID-19 positive patient, we try to avoid visitations. That being said, if the patient is not doing well, we certainly understand that part, and we can get to make exceptions.
Yeah, and I just wanted to add, to just what Dr. Ceda Lopez said, end of life is very different. So we definitely make exceptions for that. So if patients are critically ill or at end of life, that we do make exceptions for that too.
Thank you. We just got another question related to the vaccine. How can I trust what's in the vaccine? I think this is something that a lot of people, you hear in the news. There's a large portion of people that say that they would not get the vaccine if it comes out. What would you say to those people?
First and foremost, I think that our obligation as physicians treating the general populace is to do no harm. And there's a scientific method in the approval of these vaccines, and they're being studied very heavily and critically, and they're being looked at to ensure that there aren't negative side effects prior to administering them to healthy adult individuals. And historically, vaccines have been safe across the board. I know in the, about a decade ago, there started to be a lot of controversy over vaccines in children and whether or not they had caused autism, et cetera. And none of these findings were ever replicated. And I believe the same process that we followed all along, the scientific method that I trust and is still being followed. And although we're doing it with more resources and at a more rapid pace, our goal is to eradicate the disease and not harm anybody. And the leadership from a scientific perspective, they have integrity. And I, for one, will be taking the vaccine, and will also be asking my family members to do so as well, because I think the risk will be very minimal based on the studies that we've seen thus far.
Yeah, and I agree with Dr. Hopkins. I mean, you have to trust the science. We've read the literature. The side effects are very minimal, and I as well will be taking the vaccine the first opportunity that I get.
And something I would like to add to what Dr. Hopkins was saying is the fact that the vaccine usually is created based on what proteins the virus has, or the RNA or DNA. And that is something that it could be determined fairly quickly, and it was determined months ago. But it takes the time to really study it, see how it progresses in animals, and then move to the human studies, et cetera, et cetera. And that's why it has taken so long to really be available. So keep in mind that is not something that is just being a concoction being put together and throwing it out there to the public to have something. It is the reason why it's taking so long is because all these tests and studies have to go through the process of animal testing, and then make sure that it's safe in human, et cetera, et cetera. So from a science standpoint, we have done our best to ensure that it is safe. And as Dr. Hopkins said, the very first part of every vaccine and every study is, does it cause harm? And we have plenty of studies actually that you can find in the literature of studies that were stopped because harm was proven, and that was it. It was stopping there. So the fact that it has moved forward is reassuring.
Is a fever the first symptom that you have when you have COVID-19?
So not necessarily. With COVID-19, something we have to remember is that you have a whole range of presentations. You have from the patient that have no symptoms whatsoever, and it just can go through the process presenting no symptoms, no fever, no cough, no shortness of breath, no X-ray findings, to the patient that it gets really sick really quick. So there's no specific order that we can see, and actually even in literature nowadays you can see symptoms being added as we speak, because we're still learning from it. The importance of the fever is that it certainly it is a signal of your body, it is fighting something. And not just that, it is something that we can monitor objectively. Unfortunately, I cannot really tell without asking how anyone is feeling, versus the fever is something that we can really measure and monitor. So that's why we have seen in the population, like the focus that it has been given to temp checks.
Yeah, and from an emergency department perspective, I would say the fever is not necessarily the first symptom. We've seen a wide range of people with just runny nose, nausea, vomiting, diarrhea, abdominal pain has been really common this time around. But I would say at least 80% of the patients that have COVID do get a fever. So it is definitely common. It just may not be the first symptom.
And just keep in mind from a public health perspective, this disease spreads without symptoms, and that's why it's important to quarantine when told to do so, to wear your mask when asked to do so, and not to just rely on a temperature screen as a clue that you are infectious. Because what makes this disease difficult to contain is the stealthiness of it, in that you can go from person to person without ever having any symptoms at all.
Yeah, I think that brings up another question that we have, and that is, aside from how highly infectious COVID is, what's the difference between COVID-19 and other infections?
So I would say how contagious COVID is. It's spread faster than anything we've seen in the past. I worked through H1N1, and this was nothing. This is definitely more contagious. And with H1N1, we didn't see as much mortality, so we didn't see as much people dying. But I think Dr. Hopkins said is the fact that there's so much asymptomatic transmission, and it's so virulent and contagious. I think that has really been the issue with trying to contain it.
Something that I will add to that is the fact that it is a different virus, it's a new kind of virus, and using the example of vaccine to most infections that we know nowadays, your body has been exposed. And when we give someone a vaccine, is to help your body to prepare for when they encounter that infectious organism. In this case, it is a new virus that has mutated and the body has never been exposed. So nobody is prepared to really fight against that. So that is the difficulty or the difference between the COVID-19 and all the other infections that we are used to deal with.
I think we're starting to transition to giving the doctors a little bit of a break here. I wanted to try to be as orderly as possible with the questions that we've received. Of course, keep chiming in as appropriate, but I'd like to start shifting over towards the more senior focused and community focused questions that we have. This one's kind of an in-between. Izzy, doctors, will boosting my immune system help prevent COVID?
So I can just say from a doctor perspective, and then I'll let Izzy and them talk. There is very limited information and studies out there, but vitamin C and vitamin D is showing some promise, but the data is just very limited this time. So I don't think it hurts if you don't take a multivitamin to start taking it. It's certainly not going to hurt you.
I know I'm all about the vitamin C, especially this time of year. I'm doubling down on it.
I think that's a really great point that Dr. Tobias brings up. You do really want to focus that there's not going to be any harm in, doing the things that we all know that do help with our immune system. Research hasn't shown that, being more active and helping boost our immune system is going to be harmful. But I think that something that we have seen is that people who are already at a more susceptible level to infection are more likely to contract COVID. So what we want to do is do those things like you mentioned, taking those immune boosters, doing things to help with our cardiovascular, respiratory, and physical health are really going to be helpful in terms of just making us a little bit more resilient. Even if we do contract, we want to make sure that we are doing these things to kind of help to lessen the effect of the symptoms.
What other things can aside from taking vitamins and immune boosters, exercise, diet, proper nutrition, those are all things that will help lift the immune system, right?
Absolutely. And I think that this is a special population that we're talking about, right? So this is our folks that have in the senior community have multiple medical problems and debilitation at baseline. So anything that's going to make you healthier, right, is going to boost your immune system at baseline. So if you have diabetes, managing your blood sugar, keeping it more controlled is going to put you less at risk to infection and a negative effect of said infection. If you have hypertension, monitor your blood pressure, right? Make sure it's being well controlled so that negative effect doesn't impact you in a harmful way if you do get infected. And then just daily healthy living, diet, exercise, trying to be positive and happy to alleviate depression and engage in community activities are all baseline things that you can do, not just to combat COVID, but just to live a healthier daily life.
And not just that, I would like to add, build a little bit more of what Dr. Hopkins mentioned, is the fact that mental health has a huge impact on physical health. If you're not feeling at your maximum, if you're feeling depressed, you're going to be more prone to get infected or get disease. And it has been proven that patients that are depressed do poorly after getting any kind of medical alignments or illness. So it is extremely important to really keep an eye on your mental health and be honest with yourself. If you're not feeling healthy from a mental health standpoint, seek help, because it does affect the physical health.
That's actually a great segue to our next question, where we were asked, how can I manage my anxiety about COVID-19?
So just basically the best way is going to be try to stay active. The body actually release hormones and endorphins that really decrease anxiety level, makes you feel better. And I know it's quote unquote a cliche of yes, exercise, it is the answer, but honestly, exercise does help a lot. And the best proof to it is like before you start exercising or going for a walk, you feel like, do I really have to do it? But right afterwards is like, oh, I can conquer the world. What is next? And you have to just keep going with that feeling. Obviously, there is medications available, but we try to limit these medications because, as everything, it can have side effects, and they can create dependence, some of them. So if we can't really help the anxiety or the mental health part with exercise, diet, it will help. Something that also helps is find a new hobby, like do something with your hands, like learn crocheting, like paint a room, um, try to learn how to use a browser if you're not very computer savvy, like just learn something new that it gives you that sense of accomplishments and that pat in the back to yourself, hey, you did great.
And then just to add to that, if COVID is something that is promoting anxiety for you, be informed, but turn off the noise. Right? Having CNN on 24 hours a day, if COVID's making you anxious, wouldn't be the best thing for you to be exposing yourself to on a regular basis. And look to do something that's different or alternative or isn't centered around COVID. Obviously, if you're having anxiety to the level that you need treatment, don't not seek treatment. Right? There's resources out there at the emergency department for those that might be anxious to the point where they're medicating with alcohol or other illicit substances that might be having negative thoughts about themselves. Don't stay quiet. Seek treatment, seek help. There's medical professionals out there, both in person and via video, that can perform therapies, cognitive behavioral therapy or counseling, as well as provide medications if need be. For one, I know that at this community, we're going to have our behavioral health care managers on site helping with the residents, as well as our team psychiatrist, Dr. Chris Mineta, who will be involved in any of our resident treatment programs at the community.
Yeah, if I can follow up from Dr. Hopkins, working with seniors for over 30 years, we know that depression is often something that they are feeling even when they transition into a community. And what we've seen is the positive effects of being in a community by the interactions of other people, the fact that they're seeing and living with people that are very much like their age, and the environment in a community is at the pace of something that fits better for seniors than, a more fast-paced, younger type of environment. Additionally, we will be having activities and recreation events that will incorporate a healthy lifestyle, good nutrition. So often what's happening is seniors right now have fear of even going out or may not have access to good nutrition. If they're afraid to go into the grocery store, they're not able to keep up on or even remember that they've been eating and their family hasn't stopped by. The minute you lose hydration, don't have good nutrition, you're self-isolating, you focus on your fears, and that's all you have to focus on. Our goal in a community is to break that cycle. And we know that by breaking that cycle, when we talk about anxiety, when we talk about fear, and when we talk about stress of living in the pandemic, we know that by being with others in a more positive way will allow our seniors to prosper during this period of time. And of the seniors that are choosing to move with us, it is our commitment to ensure that the quality of their life is improving while the pandemic is all around us. And it is about the staff's dedication and the resources we offer them. So we see all the positives when people come into senior living communities. I see a quality of life that improves. I see joy in families being able to interact with their loved one, where the focus isn't always on the illness or how they're feeling, because all of a sudden life is coming back to them. And we are dedicated to offering that. And I always said that we're a social environment, but we have to manage the medical behind the scenes. And so what we attempt to do is flip your focus from the worry that's going to be present every day and minimize the effects of that worry by giving you good nutrition, giving you socialization, having good health care, working on rehabilitation, and being a partner and getting you access that you get to do the living. And that's the commitment of all of us here today, is to be part of that will create that environment.
Yeah, when you're in a community, you have access to so much more than if you're at home.
Absolutely.
So the next question, kind of leading into that, it's a twofold one. Number one, will family be able to visit me in the community? And number two, will there be activities available?
So Dr. Hopkins has been out there, so he knows in communities that it's gone through all kinds of phases. It is still in different phases, and a lot of it has to do with the local community. If it's surging in your county, what do? It also has to do with kind of the configuration of your community, and there are specific plans in every stage of where it is in the local. So we have to literally track the county's infection rate, and based on where they are, you have to impose that within your community. But what we've learned is that since March, there is creative ways of still doing the things. So right now, senior living communities, based on where they are in their plan, because it's all individualized in a lot of ways, they will encourage, right now, I think most of them, or half of them, are working on a common place in the community to visit, which is less restrictive than when no one could visit. The goal, we have the holidays coming up, and that's really becoming a stressor to people, because especially Thanksgiving and Christmas tend to be holidays that are family oriented. And so, how does a family interact? Well, we hope to be able to be creative in our approach. We will ensure that your loved one is able to enjoy the holiday if you're not able to be with them. The community will look beautiful, the meals we'll serve will be amazing, and the staff will be there because we're there every day. Maybe, you won't have that same interaction, but we are going to be using iPads, we're going to be doing Zooms and telephone calls and Facebook interaction, and it is kind of a new modern way, but I think we're all learning to navigate it. So 100%, I can't promise you today where it will, as it cycles, where the level of interaction or visitation will be, but it will always be with the best interests in the well-being of your loved one.
Yeah, I think it's a moving target. I think you have, and what I've seen over the past several months is it's driven by the community activity, not the community, the senior living community, but what's happening around you. And is everybody doing their part? I think where we've been and where we are now is the shutdowns were much longer back in spring of this year. And now we actually have a phased approach to how to handle this. And also are very proactive in trying not to isolate seniors for prolonged periods of time. So I think what I've seen in a new community that I have been involved with over the past several months is that the seniors in that community, as we go in and out of red and green phases and allowing visitation and then not allowing visitation, have really begun to rely on one another and really value their friendships and the support with one another in the community. And although the isolation from their families can be frustrating, it's shorter than it was before, and the community is a resource to them to get them out of their rooms, to get them down to meals, and to interact with other people, which is a big deal, and it has been a big plus moving into the winter.
So within the community system, visitors aside, when you're living your daily life in the community, again, you can't say what will happen if we have to go into a more strict lockdown, but we are finding creative ways to do in-person activities. There's still meals in the dining room, so that socialization is there within the community for you to experience with other residents and staff members.
Correct.
Yes, I definitely believe that the one thing that has been learned from this process is the long-term isolation. You balance whether you keep someone isolated from getting the disease versus their mental health, which will eventually affect their health as well. So we're finding that balance that will still keep them safe and limit cross or potential transmission, but at the same time still allow the mental health, the holistic approach to someone's life. And
great.
staff is always there in the middle of the night. There's somebody there when you're fearful, when you're worried, when you're sick. You know, you can't always get someone to your home. There's always staff. And Dr. Hopkins, I believe you're going to be using telehealth. So you'll have access almost at any time, correct? How do you interact when maybe it is a difficult time in a community? You can still actually see the resident. Am I correct?
Oh, absolutely. And you know, we do also still come on site if it's allowed, and we do a calculated risk assessment. And you know, we're not going to not see our patients in communities that are COVID positive, because we don't want to neglect those that aren't, and we want to make sure the ones that are receive proper treatment. And we also want to interact with staff and promote infection control strategies and help support them in any way we can. We also get very creative with our patients in the senior living communities. For instance, I have a patient who needed a cardiac workup, and the family was going to take him out of the community after he saw a new cardiologist, and that would have put him on quarantine for 2 weeks, and he was supposed to have 3 studies over a 3-week period. So you can imagine he was not thrilled to have to be on quarantine for a very long period of time. But being a patient advocate, I was able to reach out to the cardiologist and get the information, and we came up with a plan to do the imaging studies on site so he wouldn't have to be in quarantine, and then to delay the more complicated procedures until after the pandemic is over. So there's a lot of coordination that's going on around folks living in this type of setting that you don't typically have access to outside of a community or congregate care setting.
I think it's also really important just for everyone to think about their place in all of this, right? It doesn't matter how old you are, you have something that can be added. And one of the reasons why we're looking at 6 different faces right here is because we all have something to bring to the conversation. And so as a resident of a senior living community, or someone who's living at home or with family, you can bring up ideas. You can say something that maybe no one else has thought about before, that could really be a game changer to make everyone be a little bit more involved and a little bit better coordinated along this way. So, you know, I don't think that 2 years ago anyone would have been thinking, hey, I think it's a great idea to get these people together and to have this, you know, conversation about a condition, you know, to really talk about things that no one was thinking about, right? So if we don't bring them up, if you as residents and you as patients don't mention something that's important to you, it won't get addressed necessarily. So I think it's really important to also speak up and be an advocate for yourself, but also for your family members.
Great point. Okay, so what happens if someone gets COVID-19 in a senior living community?
So I can speak from experience. It's, you know, typically if somebody's symptomatic and we're getting a call about a patient evaluation for COVID-like symptoms, we will have them swabbed on site. We have a supply of testing materials that get sent out the same day. And then that individual who's suspected to be infected would go under quarantine to protect the lives of the other individuals in the community. Based on their severity of illness, we would assess them, meaning we'd say, hey, how sick are they? And if they're very sick and they need to go to the hospital, we won't hesitate and we'll send them to the local emergency department. But if they are not that ill that they need hospital level of care, we'll initiate care in place. So we will start to render treatments that can be rendered in the community. We'll call on our partners in home health to come and see them, to monitor them when they can't be there, and then we'll monitor their vital signs on a daily basis for a extended period of time to make sure we don't see them declining, much like Dr. Tobias had mentioned, monitoring their temperature and oxygen levels remotely so that we can ensure that they do progress and get better, or if they are getting worse, they receive the level of care necessary for treatment, such as a hospitalization.
I think another important point to point out is all of these different healthcare services are working well together. I believe Dr. Lopez mentioned that, you know, anyone going from the hospital before they go back out into the community, whether it's local or their own home or a senior living community, are being tested. And so we're all working together to minimize the transmission, even through the different sections of the healthcare entities that are present. With that said, senior living has been dealing with illnesses and diseases that are highly transmittable for years. Under CDC, we've always had to have infection control. And so often the same protocols that have been in place for other highly contagious types of diseases or illnesses or viruses will be instituted. So from the world of senior living, we are already prepared to deal with anyone who has an illness that could be contagious to someone else. I think everybody hearing that it's COVID thinks that it's going to, it's something that we don't know how to handle. It's something that is definitely highly transmittable. We know that it's moving fast. It's new to everybody, but the protocols we put in place are not new. They're improved, but they're not new. And so I love the fact that I have these partners with me today and that this team will look at what's best. And in a new community, we have plenty of room and most of our residents will have private apartments. So they're just going to be taken care of in that area until they're safe again, unless they need the hospitalization, which we have partnered with. And the communication among all of us will be the key.
Yeah, and I think your point earlier where you indicated the protocols and the procedures, it's not just about that one person when they need to self-quarantine, when they're suspected of having COVID. The community daily, hourly is going through infection control and sanitization practices. We have electrostatic sprayers and all of this really high-tech equipment. So if somebody was suspected of COVID and had to quarantine, we're going to go through even more than we did before and do another deep clean. So the protocols that we put in place once somebody is diagnosed go beyond just managing that one resident's need. We roll out policies and procedures immediately across the whole community, correct?
Absolutely. And there is actually more frequent testing that occurs based on the recommendations from the Department of Health and the Department of Human Services for our staff and for our residents. And so I think often we're identifying people that may not even have the symptoms to know they have COVID. As it was expressed earlier today, COVID is now manifesting its symptoms in very much different ways in different people. So sometimes people are coming up with a positive with no symptoms at all. We know they have positive and we're still going to treat them as positive, but they may not feel as bad. Other people feel like they have a very bad cold or flu-like symptoms, and then others have been very serious, which has made this virus very interesting and very unique of itself, that it manifests differently in a wide variety of ranges. But where we have increased our infection control is those high touch areas. The ability to know that handrails, every chair, wiping down anything you touch, just things you took for granted are now, and the sprayers have immediate. A lot of people go to clean with the disinfectants that they have at home. If they don't read the kill rate, they might spray and wipe too quickly. Well, a couple of different things are happening. Some of the higher tech stuff is doing the kill rate at a much quicker time, quicker speed. Some things are 1 minute, some things are 3 minutes, some things are 5 minutes. But with the spray, you don't even have to dry them, which is nice because it's a mist that's going to have a wide range. And we literally have backpacks and gun sprayers and everything. It almost looks like, they're walking around in these big outfits kind of spraying down, but it has been proven that it is working. And we are using, and Vantage Point is dedicated to having the most, they're sparing no cost when it comes to infection control. I think all of these healthcare entities have learned that you have to have the right equipment, you have to have the right knowledge, and infection control is something that we've worked with in our professions and we're used to.
Along the topic of infection control and things like that, we have a question from somebody who is wondering about how safe the air quality is within senior apartments. Living in a community that has shared ducts and things like that, is there a risk to get COVID through that manner?
It's kind of interesting that you brought that up because a new community absolutely has the most state-of-the-art equipment. And actually, the Department of Health and Labor and Industry really look at that for a multitude of reasons. So in our specific community, it is very much drawn out of the individual's apartments, basically in the ductwork right outside. So, and a lot of things now have HEPA filters that are already cleansing, very similar to how hospitals have been, have had to have their airflow and airplane systems. We're understanding that much better. And absolutely communities look at that. And I know that Arcadia is being built with state-of-the-art airflow system.
Okay. And then we have another question related to visitors and activities within the communities. Would residents ever need to be confined to their apartments even if outside visitors cannot visit? I know this is a tough one.
It happened, and it happens sometimes. I think what Dr. Hopkins said is, you really don't know. Everybody's on the forefront hoping to minimize it and keep it at low levels. We are mandated through the Department of Health, depending on what phase or stage we would be in, inclusive of the county, which is interesting. Dr. Hopkins, are you seeing that currently, not like you did in March, correct?
Correct. I mean, I think you have to understand every senior living community is not created equal, right? And the fact that you have put together this panel, I think speaks to the level of excellence that you're trying to achieve in the clinical care that you want to offer your residents or prospective residents. So I see it in a variance based on how the senior living community operates, right? The higher the level of care, the higher the attention, the more likely that they're going to do rapid widespread testing on a high frequency basis to ensure that folks aren't quarantined to their rooms because the infection control strategies are very aggressive. So, I think my sense is that that's the approach you guys are going to take. And the other approach, when people are more lackadaisical and just doing what's mandated, you will see isolation because they're trying to control infection when there's a widespread outbreak. But as long as a strong strategy is in place, it should be less frequent or hopefully not occur at all.
And I think that's why I want to thank so much all these people from this panel, because they've all stepped up they all want to be part of something unique and special. And we're trying to ensure that we're being advocates for the senior population. And all of the panelists that join me today have supported our community and just support our ability to be the best that we can be as we open this community during a very tough time.
And with many of the communities that I work with as well, we see a lot of different approaches. And I think the collaboration and the communication are huge. That's a big part about what I do, is making sure that the clinical team on the ground, our office staff, the physician groups, everyone is on the same page. I love when we get the same email over and over, because what that's going to do, it's going to help us to see, some of us are laughing, right? Because we get that. And I think the great thing about that is that it improves the coordination. And although these things aren't new, I think it doubles down the resolve in terms of making sure that we're not only doing what's in the best interest of the residents and our seniors, but also that we are doing what's best in terms of keeping people engaged. And again, I think that in terms of like the fear and anxiety, it's things like this, right? It's panels like this that are going to help you to kind of cut through all that background noise, like Dr. Hopkins said, and to kind of hopefully get people a better idea as to what to focus on, and the things that, yes, we should be more concerned about, but also the things that, you know what, we can make it through this. So thank you.
Yeah, this panel has been incredibly educational for me personally, but I hope for everybody that's listened in. I think it just speaks volumes for everybody's willingness to participate in this discussion and to be on board with wanting to get the facts, not fear, out to the residents who will be moving to Arcadia. And I know there's a lot of people watching outside of the Arcadia family. So I really appreciate everybody's time during this panel. We've kind of run through a lot of questions, and in the last few minutes that we have left, I'd love to just kind of offer each panelist kind of a parting message or some type of insight that you'd like to share before we get off of the call. I'll start with Dr. Tobias.
So I think, my message is going to be the emergency department's open 24/7. We're here for everybody. Please don't hesitate to come to the emergency department if you are feeling ill or if you have any concerns. And I think that I'm super excited after participating in this panel, working with Dr. Hopkins in ways that we can keep COVID positive residents, if that becomes an issue there, how do we keep them in their apartment and at that site, and try to figure out a way to monitor from there and not have to send this poor people to the emergency department and get admitted. So I'm excited about the opportunities to work together.
Dr. Ceda Lopez.
Similar to the message from Dr. Tobias, like just understand that if you do come to the hospital, we will be ready to receive you, and you will receive the same level of care that you will have prior to COVID. I do know that COVID has had very strong effects on everyone's life, but by now we have been learning and understanding what it is and how can we work around it. So as we transition you through the healthcare, be reassured that we will be doing what is best.
Dr. Hopkins?
Yeah, I think, Dr. Tobias, I'm extremely excited to work with you guys as well. Dr. Ceda Lopez, I think it'll be a great partnership moving forward, and the coordination with everybody on the team. I think that the one thing I will offer is you cannot predict the future. None of us can, right? We can all do our part and we can do our best, but the better prepared you are, the better the result is going to be. And this panel has illustrated that there is a level of preparedness with the community that you don't see at other communities. And I would not hesitate to recommend for someone to move into the community and for that to be safe. And if you're putting off moving into a community out of fear, I think that that you should give that a second thought with what was discussed on this panel today. there are strategies in place to safely live in a senior living community, and we will do our best to ensure that we decrease the infectious rate as much as we can and keep you active and keep you engaged. And finally, wear your mask.
Izzy?
I also just want to say how how touched I am to be a part of this. And I think that this collaboration communication is just so huge. For anyone who's feeling anxious or afraid, ask the questions, have those conversations. That's one of the best ways that you can hopefully overcome that, is by having the right information. And I think it's also really important to, when you're thinking about yourselves and your families, no one is going to be mad if you call them and tell them that you love them. Okay. So just having that discussion also is huge, and just staying more connected with each other and realizing that if we can't be together, there are intermediates that we can use. And, as an intermediate service between hospitalization and primary care, home care is also there, just to kind of help to make sure that people are staying active, staying healthy, and also reducing some of those risks of hospitalization as well.
Karen?
I'm just excited. I've learned a lot myself today, and I love the fact that we're looking at it more in the positive way, not, all the things, as Dr. Hopkins said, CNN talks about nonstop. So hopefully they're watching us. I guess when I think about Arcadia, in the process of looking at support and the people we wanted to get involved, every one of these people were highly sought after. And I interviewed a lot of different companies, and I'm excited to be able to have this high skilled, really committed group. And I think when you find liked people, you can do so good, and you can do better, and you can think out of the box. And our commitment at Arcadia really is to bring, life back. And maybe you can consider Arcadia like a resort. You guys are all welcome to stay a night too.
Anytime.
Free on me. And I really think Vantage Point and Kate, you've done a great job getting us together. You were the brainchild of this panel, and it worked out way better than my nerves would have thought it was going to work out. So thank you, other than my miscue on my camera in the beginning. But Vantage Point is just the wholesomeness and of Greg and Rita Stevens, and everything that they bring just embodies through everybody that works for them. And now I've had the ability to find some really great support systems out in the Limerick area, and I'm very excited. So
Yeah.
Thank you all.
Absolutely. And thank you everybody for watching. If you have any questions that weren't answered, you can, we'll leave that chat box up. You can submit in the chat. You can email team@arcadialife.com and we'll get you the answers that you're looking for. But we really hope you enjoyed the presentation, and it was really our pleasure to bring this to you, and hopefully you got some good tidbits of information from it. So thank you all for joining us today, and thank you all panelists for helping out. It was great.
Thank you. Stay
Thank you.
safe.
Thanks a lot.
All right, bye everybody. Thank you.
Take care.